Hi, welcome to New Mexico Mission of Mercy, the Restorative Department. I'd like to introduce you to one of our restorative leads. That's Dr. Tom Scripsima. Dr. Scripsima, can you tell some of the dentists what they can expect when they come to Mission of Mercy? Sometimes they have questions as to whether or not they should be bringing special equipment.
Most equipment will be provided at the Mission of Mercy. However, there may be individual things that dentists would like to have that they're used to using on a regular basis and so on, and they're welcome to bring those materials with them. We would recommend that they label instruments and so on with their name and identifying features so that they don't get lost and mixed in. There's going to be a lot of that kind of thing going on. We'll also have all of the different kinds of materials that they're going to need. However, if there are particular things that they like to use, particular bonding agent or particular restorative material, it might be best if they bring some of their own just to have it on hand.
Of course there will be chairs provided for them, but if there's a really special chair they want.
Yeah, absolutely. I mean, patient chairs probably will be there and ready to go, but the stools are pretty generic. They don't fit anybody very well, so they're probably better off bringing their own chair, especially if they have something that they're used to using.
Of course, dentists always know to bring their loupes when they're going to be outside of their own office. What are some other things maybe they would want to bring to Mission of Mercy?
Well, personal protective equipment can be pretty personal, and so if there are particular masks that they're comfortable with, the glasses if they're not wearing loupes, gloves, sometimes size-wise it's important to get just the right ones and that kind of thing. And if they have those kinds of needs, then we would certainly recommend that they do that as well as a gown or a smock.
Okay, and let's talk about some of the things the dentist should know when it comes to the patient forms, how you want them to fill those out.
Generally, the forms are pretty self-explanatory and they're fairly complete. We'd like them to fill those forms out with blue ink because there's going to be a lot of markings that are on there, and those who are doing that data entry need to be able to pick out those items that they have indicated on the form that are important to the patient's record.
It's not their office, so it's going to look a little bit different, and there are just so many dentists and so many different things happening on the floor. Will there be special containers for the different sharps?
Absolutely. Sharps should not be moved out of that area, and so therefore there will be sharp containers spread throughout the restorative area, usually probably within 2 or 3 chairs of where they are. And we'd like them to dispose of those sharps before they bring instruments to the sterilization area.
What types of materials can they expect to find there in the restorative department?
We'll have pretty much any of the materials that they would want to have, but not necessarily the brands or the delivery systems that they're used to. So they should find the kinds of things that they will need, I think, under most circumstances, but just be prepared to go with the flow a little bit with regard to the materials that are available.
And if they bring their own equipment, there's a separate area in that sterilization department. Is that correct? That's
right. There'll be a place that they can put those instruments or keep those instruments segregated from the instruments that belong to the Mission of Mercy. Place those instruments into the little cardboard restorative materials boat so that they can be transported to sterilization in the closed container. But we also then at that point would try to wipe down the chairs and disinfect all those areas, because everything needs to be disinfected between every patient. Once that's been completed, they can raise that red card, and that would indicate that they now are ready for another patient, and the escorts will bring them the next one.
What would you like dentists to know about the HIVAC system?
Well, the vacuum system is very efficient and works very well in the clinic, but it's a little different than what they might be used to in their home offices because it's running on the surface and so on. So what we're asking is for sure not to allow patients to close on the suction device. We don't want to have that negative pressure that might allow some of that material to flow back to them. We would like then, when they're completed or when they're through using the vacuum device, to shut it off, but before turning off the valve, raise it up so that it's allowed to drain with gravity down below the valve. And then between each patient, they need to make sure that they run some of the vacuum cleaning material, which will be available in the different locations around the clinic, through the system. And you can imagine with all the patients that are going through at any given time, we've got to stay on top of keeping it clean that way.
Sometimes in the restorative department, a dentist will find that a patient needs an extraction. How should they handle that?
We would ask them to bring that issue to the restorative lead, myself or whomever would be there, and we'll take care of getting that patient referred over to the surgical area if we need to do an extraction or an endodontic procedure or something else.
And what should the volunteer dentist know about pulp exposure?
We do not treat pulp exposures in restorative, so if one occurs, we would like them to bring that to the attention of the restorative lead, and again, we'll take care of referring it to the proper place. They should not use pulp capping materials like dical calcium hydroxide. There's just too much of a chance that the patient's going to have complications later on after the mom is done, and we'll have no place to go for that.
And how about the amalgam separator? What would you like the dentist to know?
There will be amalgam separators at the end of the line, essentially, in the vacuum system, and so we are being very conscious about not allowing amalgam into the water system. It'll be separated. What
is the dental protocol for crowns at this Mission of Mercy?
Well, for the first time, we're going to be able to offer some full coverage crowns. It's on a somewhat limited basis. We can't do it on every tooth that we might think would need one. However, we're going to prioritize endodontically treated teeth and more badly damaged teeth. We'll be able to do 45 crowns during any shift using a CEREC machine. So they'll be done right there and then cemented in place before we go ahead.
I understand there'll be a very limited number of CEREC crowns that are performed. If someone does need a crown, what is the protocol?
Generally speaking, as they're coming out of triage and going into restorative, if it's something that we can anticipate that they need, we will give them a restorative card right at that point and send them over. Otherwise, there will also be restorative cards in the endodontic department, and when the root canal is completed, they will get a restorative card and then have that, or the crown card from restorative in order to be able to do it. So those are the protocols that we'll follow when we're trying to determine who is going to be able to get the CEREC crowns.
What is your goal for restorative dentists as far as how many patients they can see per shift?
We'd like each of them to plan to try to see at least 8 during their shift. It's about 45 minutes is what's allowed for each procedure. They can get as much done in 45 minutes as they can, but we'd also like to keep that moving. There's going to be a lot of people in line, and we want to try to serve everyone that's there. So we're trying to limit it to one service, but to the extent that they can get in during 45 minutes, we're encouraging them to do it.
And you'd like your dentist to also include that cleanup time in that?
Absolutely. They need to be able to move those patients through on a regular basis, or we're just going to have people waiting in line.
And dentists shouldn't forget their DEA numbers.
That's correct. Inevitably, there's probably going to need to be some prescribing of narcotics and other kinds of things, and so they will need to have all that information and be able to prescribe that. And we're asking that they would bring a prescription pad as well.
Okay, and Mission of Mercy will also have some generic prescription pads available, I understand?
That's right.
Just in case those have been forgotten.
That's right.
And I think probably the most important thing we're saving here for last.
Yeah, absolutely. I mean, we want people to have a good time. We want them to be able to feel good about the time that they've spent with it, and we really appreciate the time that they've spent on it and want them to enjoy it.
And maybe ask those dentists to be flexible being outside of their office for the day.
Absolutely. I think that that's going to be essential to making it easy.